Hi everyone, welcome back to my YouTube channel. In today's video, I will be going over part 2 of calendar year 2023 Medicare Physician Fee Schedule Final Rule. Just so you know, I am creating part 3 to cover some more of the key takeaways from this final rule. So please stay tuned for part 3. But in today's video, which is part 2, I will be talking about how calendar year 2023 Medicare Physician Fee Schedule Final Rule impacts chronic pain management and treatment services, opioid treatment programs, audiology services, colorectal cancer screening, and Medicare Economic Index. Let's get started. Chronic pain management and treatment services. CMS finalized a calendar year 2023 proposal to create two new G codes, G3002 and G3003, performed by physicians and other qualified health professionals, describing monthly chronic pain management and treatment services, or CPM, for payments starting January 1st of 2023. CMS believes the CPM HCPCS codes will improve payment accuracy for these services, prompt more practitioners to welcome Medicare beneficiaries with chronic pain into their practices, and encourage practitioners already treating Medicare beneficiaries who have chronic pain to spend the time to help them manage their condition within a trusting, supportive, and ongoing care partnership. The finalized codes include a bundle of services furnished during a month that CMS believes to be the starting point for holistic chronic pain care, aligned with similar bundled services in Medicare, such as those furnished to people with suspected dementia or substance use disorders. CMS has finalized the CPM codes to include the following elements in the code descriptor: diagnosis, assessment and monitoring, administration of a validated pain rating scale or tool, the development, implementation, revision, and/or maintenance of a person-centered care plan that includes strengths, goals, clinical needs, and desired outcomes, overall treatment management, facilitation and coordination of any necessary behavioral health treatment, medication management. The following elements are also included in the code descriptor: pain and health literacy counseling, any necessary chronic pain-related crisis care, and ongoing communication and coordination between relevant practitioners furnishing care, such as physical and occupational therapy, complementary and integrative care approaches, and community-based care as appropriate. Opioid treatment programs, or OTPs. In order to stabilize the price for methadone for calendar year 2023 and subsequent years, CMS is finalizing the proposal to revise their methodology for pricing the drug component of the methadone weekly bundle and the add-on code for take-home supplies of methadone. As proposed, CMS will base the payment amount for the drug component of HCPCS codes G2067 and G2078 for calendar year 2023 and subsequent years on the payment amount for methadone in calendar year 2021, and update this amount annually to account for inflation using the PPI for pharmaceuticals for human use prescription. Additionally, based on the severity of needs of the patient population diagnosed with opioid use disorder, or OUD, and receiving services in the OTP setting, CMS is finalizing the proposal to modify the payment rate for the non-drug component of the bundled payments for episodes of care to base the rate for individual therapy on a crosswalk to a code describing a 45-minute session rather than the current crosswalk to a code describing a 30-minute session. This will increase overall payments for medication-assisted treatment and other treatments for OUD, recognizing the longer therapy sessions that are usually required. CMS is also finalizing the proposal to allow the OTP intake add-on code to be furnished via two-way audio-video communications technology when billed for the initiation of treatment with buprenorphine to the extent that the use of audio-video telecommunications technology to initiate treatment with buprenorphine is authorized by the Drug Enforcement Administration or DEA and Substance Abuse and Mental Health Services Administration at the time the service is furnished. CMS is also finalizing the proposal to permit the use of audio-only communication technology to initiate treatment with buprenorphine in cases where audio-video technology is not available to the beneficiary and all other applicable requirements are met. Additionally, CMS is allowing periodic assessments to be furnished audio only when video is not available for the duration of calendar year 2023 to the extent that it is authorized by Substance Abuse and Mental Health Services Administration and DEA at the time the service is furnished. Additionally, CMS is clarifying that OTPs can bill Medicare for medically reasonable and necessary services furnished via mobile units in accordance with Substance Abuse and Mental Health Services Administration and Drug Enforcement Administration guidance. CMS is finalizing the proposal that locality adjustments for services furnished via mobile units would be applied as if the service were furnished at the physical location of the OTP registered with Drug Enforcement Administration and certified by Substance Abuse and Mental Health Services Administration. Audiology services. CMS finalized a policy to allow beneficiaries direct access to an audiologist without an order from a physician or non-physician practitioner for non-acute hearing conditions. The finalized policy will use a new modifier instead of using a new HCPCS G code as CMS proposed, because CMS was persuaded by the commenters that a modifier would allow for better accuracy of reporting and reduce burden for audiologists. The services can be billed using the codes audiologists already use with the new modifier and include only those personally furnished by the audiologist. The finalized direct access policy will allow beneficiaries to receive care for non-acute hearing assessments that are unrelated to disequilibrium, hearing aids, or examinations for the purpose of prescribing, fitting, or changing hearing aids. This modification in their finalized policy necessitates multiple changes to their claims processing systems, which will take some time to fully operationalize, but audiologists may use modifier AB along with the finalized list of 36 CPT codes for dates of service on and after January 1st of 2023. CMS finalized the proposal to permit audiologists to bill for this direct access without a physician or practitioner order once every 12 months per beneficiary. Medically reasonable and necessary tests ordered by a physician or other practitioner and personally provided by audiologists will not be affected by the direct access policy, including the modifier and frequency limitation. Colorectal cancer screening. For calendar year 2023, CMS is finalizing as proposed 2 updates to expand their Medicare coverage policies for colorectal cancer screening in order to align with recent United States Preventive Services Task Force and Professional Society recommendations. First, CMS is expanding Medicare coverage for certain colorectal cancer screening tests by reducing the minimum age payment and coverage limitation from 50 to 45 years. Second, CMS is expanding the regulatory definition of colorectal cancer screening tests to include a complete colorectal cancer screening where a follow-on screening colonoscopy after a Medicare-covered non-invasive stool-based colorectal cancer screening test returns a positive result. A functional outcome of their policy for a complete colorectal cancer screening will be that for most beneficiaries, cost sharing will not apply for either the initial stool-based test or the follow-on colonoscopy. Both of these policies reflect their desire to expand access to quality care and to improve health outcomes for patients through prevention and early detection services, as well as through effective treatments. Their revised colorectal cancer screening policies directly advance their health equity goals by promoting access for much needed cancer prevention and early detection in rural communities and communities of color that are especially impacted by the incidence of colorectal cancer. Their policies also directly support President Biden's cancer moonshot goal to cut the death rate from cancer by at least 50% over the next 25 years and addresses his recent proclamation of March 2022 as National Colorectal Cancer Awareness Month. Updated Medicare Economic Index or MEI for calendar year 2023. CMS proposed to rebase and revise the MEI or Medicare Economic Index for calendar year 2023 and solicited comments regarding the future use of the 2017 based MEI weights and physician fee schedule rate setting and the GPCIS, which stands for Geographic Practice Cost Indices. The proposed method for determining the 2017 based MEI relies on estimating base year expenses from publicly available data from the U.S. Census Bureau, NAICS 6211 offices of physicians. The proposed methodology allows for the use of data that are more reflective of current market conditions of physician ownership practices rather than only reflecting costs for self-employed physicians, and also would allow for the MEI to be updated on a more regular basis since the proposed data sources are updated and published on a regular basis. Finalizing the use of the 2017 based MEI cost weights to set physician fee schedule rates would not change overall spending on physician fee schedule services, but would result in significant distributional changes to payments among physician fee schedule services across specialties and geographies. In consideration of their ongoing efforts to update the physician fee schedule payment rates with more predictability and transparency, and in the interest of ensuring payment stability, CMS proposed not to use the updated MEI cost share weights to set physician fee schedule payment rates for calendar year 2023. However, CMS solicited comments on the potential use of the proposed updated MEI cost share weights to calibrate payment rates and update the GPCI under the physician fee schedule in the future. CMS finalized the proposed rebasing and revising of the 2017 based MEI with some technical revisions to the proposed method based on public comments. The final calendar year 2023 Medicare Economic Index or MEI update is 3.8% based on the most recent historical data available. As noted above, the rebased and revised MEI weights were not used in calendar year 2023 physician fee schedule rate setting. This is it for today. Thank you for joining me. If you enjoyed this video, please consider subscribing to my channel. Take care. Bye now.